Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
The poor neck, the part of the body that's often fodder for less than positive feelings, such as I'm not going to stick my neck out, or I am up to my neck in bills. I'm going to break your neck, like having a noose around my neck. It's my neck on the line, and everybody's favorite, pain in the neck. Have you ever woken up with a stiff neck and wondered if it's something more serious? Or maybe you've experienced chronic pain that just won't go away no matter what. Today, we are going to highlight the symptoms, discuss the treatments, and answer any questions you may have on Ask the Doc, the show where we encourage our viewers to send in their health questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon, and today we're going to be talking about various causes of neck pain, such as herniated discs, spinal stenosis, and osteoarthritis, as well as explore the symptoms, diagnostic method, surgical and non-surgical treatment options available to alleviate neck pain and improve your quality of life. Let's kick things off with a question from Aaron, who reached out to us on our very own website, allhealthtv.com. Hi, Dr. Brusovanik. My grandmother's neck has really been bothering her lately. So she went to her primary care physician. He diagnosed her with cervical spondylosis and suggested that she go to an orthopedic surgeon. My question is, what is cervical spondylosis and how is it diagnosed? Aaron, you're a good grandson, and I'm really glad that you asked that question. So cervical spondylosis is sort of a term that encompasses all degeneration of the cervical spine. Here you can see a nice biodigital of the bones of the cervical spine, starting from C1 and C2, which kind of inserts into C1, and then the bones that more frequently develop spondylosis. So if you rotate to the back of the neck, you see these joints that two of each are between each level. So cervical arthritis or spondylosis may involve these joints as you develop arthritis or degeneration, and then discs are in front of the spine, and disc degeneration can also be described as cervical spondylosis. Unfortunately, this diagnosis doesn't really tell me a lot of information. It just tells me that there is degeneration, and it would be important to really piece together what parts of the spine have degenerated and what are the symptoms. So the common symptoms that perhaps your grandma may have are neck stiffness, pain behind the jaw, facial tingling. Then we're talking about things related to C5-6, pain involving the upper shoulder blade that can also be C5-6 versus the lower part of the shoulder blade, somewhere where the brow line would cross horizontally, would be C6-7. Pain that's right in the middle versus pain off midline makes a difference too. So it'd be important to seek care from an orthopedic surgeon so you can examine your grandmother, perform some exam maneuvers to see if it makes her pain better or if it makes it worse. And then you would know exactly where the pain is coming from. And then you would say that her diagnosis would be more than just cervical spondylosis. You would say exactly what the problem is, this disc or this particular joint. I hope this helps. Our next question comes to us from Sandy, who reached out to us on our Instagram page. Sandy asks, Dr. B, my husband was recently diagnosed with cervical herniated discs, which necessitates surgery. We're both terrified, especially of surgery centered on the neck. The orthopedic surgeon performing the surgery doesn't have a great bedside manner. We've seen you on TV, we both like you, so would you mind telling us what are the risks and benefits of cervical spine surgery? Sandy, thank you for reaching out. I'd be happy to explain what the surgery entails, as well as to allay your fears. if your surgeon doesn't have bedside manner, I would get a second opinion first and foremost, because surgery is like a marriage. And you really want to make sure that after the surgery, this person is still going to be there for you to walk you through the whole process. So if you already see that there may be an issue with his bedside manner, I would urge you to consider getting a second opinion. Now, here is an interesting biodigital of cervical spinal anatomy. You can see that the sternocleidomastoid muscle, which begins right around your sternum and your clavicle, ascends all the way to the back of the jaw. Hence, development of some jaw pain in patients with a C5-6 disc problem. When the neck is extended and flexed, you can see that there is a lot of motion that is seen by the middle of your neck. So the joints that bind the bones are involved, as well as the discs. And all of the above can cause symptoms. Now, the risks of surgery are many. Now, the surgery has become safer with time, especially now that we've learned to do it in a minimally invasive fashion. But there are both short-term, mid-term, and long-term risks of surgery. Of course, paralysis is always a problem or a risk with neck surgery, but these days, you rarely hear about a person being paralyzed by cervical spine surgery. Bleeding can be an issue, which can cause a hematoma or blood collection in the neck, and that can be a problem as well. That's why I'm always weary about surgical interventions in the neck performed in a surgical center as opposed to a hospital with a good ability to save someone who is in trouble. There are midterm and long-term complications. Fusion surgery is associated with problems above and below the surgical site. So patients may come in after 6 months or even after 10 years and say that their neck pain has come perhaps at a different spot. And finally, another complication for which patients often come to see me is where the surgery failed to to achieve its goal, and patient continues to be in pain. And that can be due to graft migration or hardware failure. I would really encourage you to seek a second opinion and find a doctor who you feel like you can truly relate to, somebody who doesn't have a problem with bedside manner and asking all the hard questions about risks. Our next question comes from Stephen. Stephen just reached out to us on our YouTube page, and his question for me is, Dr. Brusovanik, my neck's been giving me problems lately. I've been taking a leave, and it's helped, but the pain comes back after the meds wear off. A buddy of mine, who is a chiropractor, said it could be a herniated disc. I've tried to self-diagnose online, but there are way too many potential disorders. My question is, how can I differentiate between neck pain caused by a herniated disc and other types of neck pain? Hi, Stephen. It's funny how many patients try and diagnose themselves at home. Nowadays, there are a lot of websites that provide you sort of an all-inclusive lists of diagnosis, which can scare the bejesus out of anyone. So it's important to mention diagnostic modalities. I love an MRI. That is a study where you lay inside a tube and pictures are taken of your neck that show both bones and soft tissues and nerves. So an MRI would be an essential modality. X-rays are a bit outdated, but they can also provide you some very useful information. CAT scan is just for bones. So if you've already had a procedure involving either a disc replacement or a fusion, then a CAT scan may be indicated. Now, there's no substitute for a physical exam performed by your doctor. Neck motion is assessed, and then your doctor looks at all these other elements like weight loss, like associated findings. Disc herniations in the neck are often associated with neck stiffness, neck pain, headaches, especially in the back of the head, facial pain, shoulder blade pain, so all the way down to your thoracic spine could still be a cervical problem. And finally, when a disc herniates and starts to irritate a nerve, you start to feel pain all the way down to the arm, which may include numbness, and in end stages, even weakness. Sometimes this pain takes your breath away, but please don't take my opinion over the television set. Get an opinion from a physician who has the ability to examine you and look at all your personal criteria. Francesca just sent us another question through YouTube. Francesca question is, hi doctor, I have neck pain. My arms are becoming occasionally numb. My hands are clumsy and I'm losing balance. But what worries me the most is when I look up at the sky or touch my chin to my chest, it feels like an electric shock going down my back. Francesca, I'm sorry to hear that you're in pain and feeling all these unpleasant sensations, but I don't want you to worry. What you're describing is common. Clumsy hands, numb hands, stiff neck can be associated with spinal cord compression. I know that that sounds scary, but spinal cord compression without trauma is a very slow process and is usually not something that should prompt you to go to the emergency room. Although once you start feeling those electrical sensations going up and down your spine, when you bring your chin to your chest or bring your head back, that's called the Lermite phenomenon. It will be important for you to get an evaluation. And I'm not saying that spinal cord compression isn't important. It can be an emergency, but I don't want you to hear me say this and necessarily say, oh my God, I'm going to be paralyzed. A lot of times I hear this from patients, and I just want to say to you that it's important to get an evaluation if you are having these symptoms. Sometimes spinal cord compression can be something temporary that will go away, but oftentimes it's something that does need to be addressed, and it would be important for you to seek care from either a neurosurgeon who is comfortable dealing with spinal cord compression or an orthopedic spine specialist. Another question from allhealthtv.com. You should really check out this website when you get a chance. It is chock full of great information. Matteo asks, hi, Dr. Brusovanik. I went to my primary care physician last week because I hurt my neck playing hoops. He said it's probably not a big deal and that I should take some Aleve and take it easy for a while. Doctor, I know my body, and it doesn't feel like it's muscular in nature. Should I request an MRI, a CAT scan, or X-rays? How important is imaging in diagnosing neck problems? Matteo, I love to hear you advocating for yourself. Never be afraid to get a second opinion, and nobody knows your body better than you. An MRI is my favorite study because it really shows you both the soft tissues as well as the bony anatomy. It shows you nerves that may be compressed, and it can really lead you to a diagnosis. But don't be surprised if your MRI has many findings. So it's important to seek a physician who can examine you, who can really listen to the details of your story, and then connect the MRI findings with what you are feeling. But if you are feeling like this is not just a muscular problem, then please get a second opinion. Don't hesitate. Thank you for reaching out, Matteo. This YouTube question comes to us from Felicia. Felicia asks, hi, Dr. Brusovanik. My neck is a pain in the you-know-what. I've had a lot of pain, a dash of weakness in my arms, and a pinch of numbness in my hands. My doctor says I have cervical radiculopathy and wants to try some non-surgical treatment before pulling the trigger on surgery. My question is this: how effective are non-surgical treatments for cervical radiculopathy? Felicia, I love your personality and wit. That's a great question. Let me show you a picture of the cervical spine. And specifically, I want to point out the area where the nerves exit your spinal canal. Now, this is a very small channel. You can kind of see one right there, and right there, and right there. And you can see that canal, that channel, the little window, is anchored both by the, or is bordered both by the joint in the back of the spine, as well as the disc that's in the front. Now, both arthritis of this joint and a herniation or degeneration of this disc can cause this tiny little space to become tight, which would inevitably irritate one of your nerves. Now, nerve pain goes in the direction of wherever that nerve travels. So if it's the sixth nerve, you'll see pain going down all the way down your arm to these two fingers. If it's the seventh nerve, it'll be more triceps pain, back of the forearm, and these three fingers. Eighth nerve goes to the whole back of the wrist. So again, it's important, Felicia, to really talk to your doc and understand which nerve is involved, because there are a lot of mimickers of nerve compression as well. Nerve irritation about your elbow may cause pain that looks like eighth nerve, but is actually part of cubital tunnel. Carpal tunnel, which is numbness of these three fingers, may come from the wrist. And that's something very common where patients will wake up in the morning and say they have to sort of shake out their hand because of numbness. So it would be important to get a physical exam and proper imaging. However, if you are having neck pain that's associated with both pain, numbness, and weakness going down your arm, it is difficult to say without examining you and seeing your MRI whether you have a good chance of recovery without surgery or whether it's a good idea to take the pressure off the nerve. And the reason is because nerve irritation, which can occur just from a nerve being touched by a disc, can also present with intermittent pain, numbness, and weakness, similar to where there's true nerve compression. So it would be important to get to the real bottom of your problem, and I would really encourage you to seek care from a caring and experienced orthopedic spine surgeon. We've got a Facebook question from Gregory coming to us. Gregory asks, "Hi, doctor, I was just told that I have arthritis in my neck. Is that even possible? I always thought arthritis only happened in the hands. I guess my question is this: what role does arthritis play in the neck pain, and how can it be managed?" Gregory, I know this may sound crazy, but you can get arthritis in any part of your body that moves. Arthritis involves degeneration of the joint. So whether it's your spine, your neck, your back, your hands, your elbows, your ankles, or your knees, all of that can become arthritic. Now, neck arthritis isn't necessarily a medical term. And when we hear neck arthritis, that may include both discs, which function like joints, as well as joints in the back of the spine. Don't rush into surgery. First, try different kinds of injections to see if that can alleviate your pain, because in general, arthritis isn't dangerous. So if you have no pain, but you do have arthritis, it doesn't mean you have to have it corrected. In fact, there are a great number of studies that show that elderly patients with no pain may have significant arthritis on their imaging. So it's important to let your doc really try to connect your symptoms and the findings of arthritis on your imaging. Here is one more question. This time it's from our website, allhealthtv.com, from Blaine. Blaine's question for me is, "Hey doc, what are the potential complications of untreated cervical spine injuries?" Blaine, that's not a game you want to play. This is a very important question. So there are both early and late consequences of untreated cervical spine injuries. The positive note is that most patients who have neck pain will present to the office saying that they had a history of a fall, or they have a history of neck pain in the past, history of neck injury in the past, with a long period of time after that injury when they were pain-free. So I would tell you that the search for the original causation is usually pretty fruitless. And if you had an injury a long time ago, it may show up later as arthritis, but this isn't the kind of an injury we really worry about. Now, that being said, on the complete opposite side of that spectrum are patients who have just undergone a motor vehicle accident and are laying there immobilized. The firefighters will frequently put a collar around their neck, and they're worried about paralysis. So it's important at that point to not move your neck. Don't test it. Let a doctor examine you to make sure that you don't have something called paralysis, where you squeeze the spinal cord and may potentially have something that's unfixable, such as loss of upper lower extremity function, inability to walk, something called quadriplegia. Number two, spinal cord injury, which is essentially what we just mentioned, where the canal gets pinched off in trauma. This may happen after a bad accident. So again, it's important not to move. Let the firefighters do their thing. Let the paramedics do their thing. Take it to the hospital, get an evaluation, and make sure that it's nothing that may cause a problem. Now, midterm, long-term, we worry about number three, which is chronic pain. It's possible that if you herniate a disc, it will hurt a nerve, and then you'll start having pain going down the arm. Pain can become numbness. Numbness can become weakness. You don't have to live in pain. So it's important to seek care if you've developed chronic pain after an accident. 4, respiratory problems. With spinal cord injury that is severe enough, you may have difficulty breathing. But don't forget that a minor fender bender where you impacted your ribs may also cause difficulties breathing. So don't panic. Let the docs and the paramedics do their thing. And once you have a diagnosis, you can then address it. But don't catastrophize. Most of the time, respiratory problems after a neck injury, if you're moving your arms, you're moving your legs, are not because of spinal cord injury. Number 5, bowel and bladder dysfunction. This can also happen with spinal cord injury. So please be aware of spinal cord precautions, such as a collar or immobilization after a bad car wreck or after a fall. Number 6, long-term, patients can develop muscle atrophy and contractures. That's where joints become real stiff and they have a loss of function of their hands. Now, this is usually a problem that takes years to develop. Sometimes it can be reversed. So if you're having neck pain, don't let it get to that point. Talk to your doc if there is pain in your neck or pain going down the arms, which signifies nerve pain. Number 7 are blood clots, which is an unfortunate sequela of paralysis, since a lot of these patients are sort of stuck in bed, unable to move. And finally, infections due to immobilization can happen with paralysis. And that can be both infections of the respiratory system as well as infections from ulcers, from not being able to move. You can never have too many questions, so please keep them up. Speaking of questions, here's one more on Instagram, and this is from Maya. Dr. Brusovanik, my surgeon saw my MRI and said that if I don't have surgery soon, I will end up paralyzed. He also told me that if I drive over a speed bump too fast, I may never walk again. Now, I'm afraid to leave my house. Maya, I really appreciate you asking this question. So many patients travel to see me after they've been scared into surgery. Some, like even some well-known people like Ozzy Osbourne or Tony Robbins, talk about having surgery when their doctor discovered something that they never felt. Please get a second opinion. If you've walked into the office, your arms are functioning okay, you are able to go about your day, and then a doctor discovers something that nobody else has seen and says you have to have surgery, 99 out of 100 times, if you seek a second opinion, you will find that you could avoid surgery or at least have a lesser operation like disc replacement. Always seek opinion if you feel like your surgeon is pushing you into surgery. Measure 3 times before you cut once. It's very unlikely that if you wait at least a few weeks to get a second opinion, that you will truly be paralyzed. And a study out of Yale, where they looked at patients who were in accidents, who had pre-existing spinal cord conditions, by Jonathan Grauer, showed that there was not an increased risk of paralysis. Please remember, get a second opinion. And again, I really appreciate all of the questions. I want to encourage all of you to continue sending in your questions. If you are in pain, if you're wondering what to do next, get a second opinion. You don't have to live in pain. Welcome again to Ask the Doc. Hope to talk to you next time through your wonderful questions. Thank you again.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.